Fitchburg on this Thursday, December 10th, 2020. Jeremy Crosby here. Hope you're having a wonderful day. Glad you're here with us for another edition of Talking Fitchburg. We got a jam-packed show for you today. We're going to check in with Jeff Doslick at Fitchrona EMS. He stopped by for a visit yesterday. I had a chance to talk with them. And a two-parter. They've been busy, both with a lot of calls, but also got a lot of new equipment. And we're going to break all that down for you today as we check in with Jeff for the final time this year from Fitchrona EMS. So excited to have him on the show today. He said two-part interview coming up on that. Plus, we'll get you updated on the headlines as well. And keep an eye on that snowstorm that's coming in here Friday night through Saturday night. I've seen now a 4 to 6 inch pending where you are, but still early to say exactly where and how this is going to affect us, but definitely want you to be aware of it, and we'll talk about it more on the update tomorrow and give you some safety tips tomorrow on Talking Fitchburg. But that's tomorrow. Let's start with today. And let's get you updated on those headlines. And we kick things off here. Mary Helen, coronary, discover the joy of a grateful heart. Yeah, sometimes it just doesn't seem that we're having anything to be grateful for. The weather, the daily news, politics, the aches and pains we feel. As we age, the joys we once enjoyed seem to disappear. Bah humbug, she says. Let's figure out what we can do to be grateful for in our lives today. Be ready to start your own gratitude jar in this session. You'll leave grateful that you came. Mark your calendars, Wednesday, January 13th, 2 p.m. If you want to get signed up for this, you got to email Susie at the Fitchburg Senior Center. And then a link will be sent out for the program. So it sounds like a lot of fun, and yeah, we all could use some cheering up. So definitely something to check in to. All right, I want to update you on the same day curbside pickup at the Fitchburg Public Library. We haven't talked about this in a while, and we'll be talking with the library tomorrow a little bit more on all this. But since we haven't looked at it in a while, I wanted to remind you this is where we're currently standing. Now, remember, subject to change here at different times, and especially with the holidays coming up, there'll be some special changes in the hours, but this is what we got. So when you're going to call is Mondays through Thursdays, 9 a.m. to 7 p.m., and Friday and Saturdays, 10 a.m. to 4 p.m. Face masks are required when picking up curbside orders. Social distancing should be maintained with our patrons and our staff who are placing their books in the pickup. And curbside is for same-day pickup only. Pickup can be requested once per day. Items that are currently waiting for you on hold shelf can be ready for pickup within 1 hour. Items available that are available in our library can be ready for pickup within 2 hours, and orders need to be picked up within 2 hours. Have your library card number ready. If you do not reach us on the first try, just try again. Orders must be placed directly with the staff. Cannot be arranged over voicemail or email. Hours for pickup then are 10 a.m. to 8 p.m. Monday through Thursdays, and Friday and Saturdays 11 a.m. to 5 p.m. Returning materials will be accepted through the drive-thru. Book drop-off 24 hours a day, 7 days a week. Yep, that's been back open for a while now. The book drop may be closed if the drop box or drop area is full, so returning items in the quarantine for up to a week before they are checked in. We are not taking donations at this time. Yeah, very important information there for the library. Certainly you can check out their website for more information. All right, you saw this, the COVID-19 update for the day. Dane County daily update, and here's what it says. Today, 272 people were added to the dashboard, 167 people hospitalized with 45 people in the ICU. Hospitalizations have stabilized but remain very high, which continues to stress our healthcare system. Everyone in our community plays a role in protecting community health. The most important thing people can do right now is follow public health orders. The decisions we make every day have the opportunity to stop the virus in its tracks, help stop the spread. And there's more information on this. It's all coming in from Public Health of Madison and Dane County. Again, giving you the daily update here on COVID. As far as testing goes, if you're wondering when you should get tested for COVID-19, well, wait 3 to 5 days to get tested for COVID-19 after a possible exposure, and avoid public places while you wait. So if you think you've been exposed, wait 3 to 5 days. unless those symptoms start. Get tested as soon as possible if you are experiencing symptoms and isolate from others. Stay home while you wait. So unless you have symptoms after being, if you think you are exposed, that's when you should go in to get tested. And again, wait 3 to 5 days to see if you have any symptoms that do occur from that. So very important stuff. I know a lot of people want to get tested for COVID-19. And we want to make sure you know how to do that safely and be able to get in for those tests. All right, time is running out to get your free flu shot from the comfort of your vehicle. Yeah, the free flu shots are available through the drive-through flu clinic at the Alliant Energy Center in Olin Avenue entrance for anyone in Dane County 6 months of age or older. For clinic hours and other details, you can go to the website there. This will be running at the Alliant Energy Center effective through December 20th. So flu shots, again, available for anyone 6 months and older in Dane County, regardless of insurance. And you can drive, bike, walk to get one. If you need a ride, you can also get one as well. And yeah, you can check the website for the hours on that flu shot clinic there. But yeah, definitely take advantage while you can. All right, finally, with that snowstorm coming in, want to remind you to have your car or be it whatever you've got. Do you have an emergency kit? It's very crucial, especially now, COVID, right? We're starting to be more alone, stay away from people, right? Well, let's make sure we have this car kit ready to go. We haven't really got hit with a snowstorm too bad yet. This could be the first one that really gets us in the winter mood, if you will. So this is coming from AAA.com saying pack emergency kit. 40% of Americans who drive do not carry an emergency kit in their vehicle. We want you to carry this. You got to get this, right? First aid kit, flashlight with extra batteries, rags, paper towels, pre-moist wipes, drinking water and snacks for everyone in the car, including pets, warm gloves, hats, blankets, basic toolkit, ice scraper and snow brush, jumper cables, jump pack, traction aids like sand, salt, or clumping cat litter, mobile phone and car charger, winter windshield washer solvent, tarp or raincoat and gloves, and a shovel. Just minimal things to think about having in your car. Certainly if you're doing a big travel, that's where you probably can look at putting in the water and snacks and stuff. But even traveling to and from work, if you are doing that, I mean, still really important. But you know, it doesn't have to be exact, but this definitely gives you a good breakdown of the things you should have in your car as we do turn to the winter time. You never know if there's a big pile up, or if you get trapped in the snow. So we want to make sure that you have that kit ready to go. All right, that does it for our headlines. Coming up next, we open up our guest segment. We're talking with Jeff Doslick, your Deputy Chief of Fitchburg EMS. We'll get an update from them. A lot going on over there. Stay tuned for that next right here on Talking Fitchburg.
When you protect what's important to you from COVID-19, you help protect everyone in Wisconsin. Learn how you can stop the spread at dhs.wisconsin.gov/COVID-19.
Hello, everybody. Welcome back into Talking Fitchburg. Joining me today from Fitchburg EMS, Deputy Chief Jeff Doslick. Jeff, welcome back to the show. How are you doing?
Good morning. I'm doing great. Thank you. It's awesome.
Thanks for being here. We love getting an update from your department as we do monthly, and that's what we'll kick things off here today. How are your medics doing, and what's the call volume been like with COVID?
So the medics are doing great. The call volume has been it's been picking up. We had that kind of a dip, in the middle of COVID where our run volume went down. But it seems to pick up. You and I talked prior to starting this morning on how busy it was yesterday, and today has been no change in that. So call volume's been picked up, and I think the thing that really has been kind of a little bit alarming is that the acuity has gone up as well. So a lot of the respiratory distress calls have turned into things that have been a little bit more serious. We've had some cardiac calls that have turned into things that have been serious. We've had a number of cardiac arrests over the last, week or so. And I'm hoping that people understand that, just because COVID is out there, that they need to call the ambulance if they're having some of those symptoms that, deserve an ambulance: chest pain, shortness of breath. Don't be scared into thinking that just because there's COVID out there that you should stay at home and try to tough it out. Because I think if we went back and looked, we're finding that patients are waiting too long, and then by the time they do have to call us, they're already, kind of around the corner, so to speak, and it takes a lot to get them back. So, really, for if I had a message to anybody today, it would be call the ambulance if you need the ambulance, and go to the hospital and be checked out and let them do their thing before it's too late.
Yeah, that's very important stuff. It's actually something you had talked to us about earlier in the year. That there's definitely protocols in place at the hospital clinics to keep people safe. If you don't have COVID, you still can go in and be safe.
Right.
And same with you guys too. On the ambulance, you've got a lot of tools too to keep patients safe as you're going through call after call after call. Maybe talk a little bit about that, the safety protocols you have in place, which will lead into some stuff we're going to talk about here in just a minute.
Sure. So we have, since we've had another spike in COVID throughout the area, actually throughout the country, but especially throughout Wisconsin and Dane County, we initially had instructed or suggested to our providers that they wear a surgical mask on every call if it was respiratory in nature or an airway issue, that they switch to an N95. We've actually suggested to our staff that they just wear an N95 on every single call that they go out on. And we assume, whether there's symptoms or not, we assume that every patient that we come in contact with has COVID-19. So they're going to have the N95, goggles, gloves. We'll talk a few minutes about the PAPR that we've got on the ambulance. So that's a safety precaution as far as the provider is concerned. We will ask all of their patients to put a surgical mask on at a very minimum while we're transporting them if they can tolerate it. And without exception, they should be putting a mask on the patient as they go into the emergency room. The Meriter Hospital, I think all of the hospitals, Meriter and St. Mary's for sure, they have separate entrances for the ambulances. So if you go to Meriter and it's a respiratory patient, you may not go right through the main ER entrance. They have a respiratory entrance. It's kind of a back way into the ER. So we take patients into there so that we don't go through the emergency room. We're doing things like if we don't have to do a handheld neb, we try to not do a handheld neb. We have meter dose inhalers where the patient can breathe that in. It's a little bit better for them. That aerolized medication that we put out in the ambulance. Obviously, if we have to do it, we're going to, but we will stop that treatment as we go into the emergency room so we don't, aerolize the entire emergency room if somebody does have COVID. We're still spraying the ambulance. We've got a sprayer that sprays a substance in the back that takes care of COVID. And so when the call is over, the ambulance is thoroughly decontaminated. The front of the ambulance is decontaminated. We're wearing gowns, especially with respiratory patients. So we're doing everything we possibly can to make sure that we're not getting it ourselves and taking it out into the community, and we're not giving it to the patient in the event that maybe we're asymptomatic. We're checking ourselves in the morning to make sure we're not have temperatures, and we're asking our employees to stay home if they're running a fever or a temperature, or they just don't feel well, to go get tested. I have test kits here that if an employee wants to come down and get tested because they feel that maybe they have the symptoms, and they can get the results back in 48 hours.
Yeah, it's good to know that the precautions, and you and your team have, I mean, from the get-go, it's been pretty consistent on, safety is always a priority for certainly the medics and the patient. And I think it's good for people to hear that there's a lot of thought and planning into, going out the door, and there's a lot of things that go through a medic on a way to a call, but when you're dealing with the pandemic, adding that stress on top of having to deal with everything else, I think it's great for people to hear that you're taking those precautions. Tell us tell us about some of the new pieces of equipment that you got. And I don't
Sure.
quite know. What did you say? Is it PATS?
Papper.
Papper.
It's a personal. It's a purifying papper. So if you watch any of the news on TV or you see shots in the hospital where they have the hood over the top and it has an air purifier and they wear around their waist and it blows purified air, oxygen, or not oxygen, but air into the papper. We were able to, with the help of the town of Verona and some extra money that we had set aside, we were able to purchase 2 units for each of the frontline ambulances, and then the town of Verona was helped us out with purchasing 2 units for car 15 or 17. Essentially, Patrick and I, if we go out on calls, they're put on the ambulance. We haven't made it mandatory for them to wear the PAPR on all the calls. Some of our providers wear it on every call they go on. Some of them just put it on for those respiratory calls, and some of them just don't feel comfortable because it doesn't close your face. Talking with a patient out in the field, it's a little bit cumbersome because you have to talk a little bit louder, although it's not really loud with air rushing through there, but it is, you have to talk a little bit louder.
Oh, that's okay.
And
I was like, well,
we
I don't see anything over
pride
there.
ourselves on being really professional and having good communication. And when you're talking to a patient through a big hood, it takes some of that personalized care that we all pride ourselves on doing. And so, but we're very grateful for the town of Verona that had some extra money that they got from the Safer grant and or the CARES grant. And so we've put those on the ambulances, and each of the providers have their own hood and stuff like that.
Yeah, does that, as far as keeping and reusing those products, how does that work with these? Are you having to treat it after every use? How does that break down?
The hoods are they're reusable. So once they're on, the staff can take like a cleaning cloth with some sanitizer on it and clean it, and then they can take the hood off. We've asked them to, if obviously gross decontamination or if it has a rip in it and things like that, they can throw it away, and we have more here, obviously. But for the most part, it's reusable for some patients.
Yeah, I think it's good information to hear as well, and it would be a little intimidating, as you said, with the patient care, talking through that device. But again, personal protective equipment for you and the patient, definitely top notch. Jeff, we're going to take a quick break. We're going to come back and we're going to talk about the ventilators here. So stay tuned with us. All right, we'll take a quick break. Be right back. You're watching Talking Fitchburg.
When you protect what's important to you from COVID-19, you help protect everyone in Wisconsin. Learn how you can stop the spread at dhs.wisconsin.gov/COVID-19.
Welcome back into Talking Fitchburg. Continuing our conversation with Jeff Doslick, Fitchburg EMS, your deputy chief. Jeff, thanks for sticking around with us here. I want to get to the ventilators, another device added to the scope of practice. And tell us what's this all about?
So we were fortunate with the CARES money that was out there to take a look at some products. And while we were fairly flushed with, the N95s and the surgical masks and things like that, one of the pieces of equipment that we thought would be beneficial not only for our patients, but also in the event that we had a huge ventilator shortage in the area was the transport ventilators. So with the money that we had available from CARES, and then a little bit of extra that we had from some donations that we had, we were able to get 3 Zoll transport ventilators, and we're in the process of doing training on those right now. A lot of our some of our staff has already had training on ventilators, and those that haven't, we're going over it with them. They'll be put on the ambulances. They can be used in cardiac arrest. They can be used to provide CPAP or BiPAP for patients that are in respiratory distress, where we might put a patient on CPAP that, as a provider that we have on the ambulance now, the ventilators will do that as well. The other thing that we're able to do is bi-level ventilation or BiPAP, and that will be much better for patients as well. So kind of prior to going on to CPAP, they could do BiPAP. The other idea behind the ventilators is that if we do get into a shortage in the area, which doesn't seem like we're going down that road yet, but there was a lot of talk about hospitals running out of ventilators, that we could be a source of a couple of ventilators if necessary.
Yeah, I think it sounds intimidating, I guess, when you first hear ventilator that you're carrying it on an ambulance, but it's actually it's been a common practice. How long has the ventilator been in Dane County? Has it been in? And we talk scope of practice. I mean, has it been in the tool book here in Dane County as far as a tool to be used?
It has not. We're going to be the first agency in Dane County to provide ventilators pre-hospital outside of a private ambulance service. I'm sure Ryan Brothers and Paratech have ventilators for their critical care, but as far as a pre-hospital provider and using ventilators in the field on 911 calls, we'll be the first providers in the county to do that. And, with all that's going on, and, being able to provide, good BiPAP or good CPAP to patients, and in the event that, we need to put a patient on a ventilator because of a cardiac arrest or some kind of intubation, it does free hands up where we don't have somebody, in a patient's face doing bag valve mask ventilation. We can put them on the ventilator. It may allow us not to have a second or third or fourth provider in the back of the ambulance because the ventilator is taking care of that. Or if we do, they don't have to be so close that they're, putting themselves in harm's way because, we have to bag a patient. So although we still have, the regular BLS bag valve mask ventilation with oxygen at our fingertips, the ventilator just gives us an extra level of care that, as of right now, there isn't any providers in the county doing that.
Well, and I think it's also important to note, too, that being that you're an ALS, advanced life support, and with the auto mutual aid and stuff, not only is it benefiting our communities here in the Fitchburg, Verona area, but surrounding ambulance services that are coming in. You guys do intercepts with them. How does this help improve the outcome of these other services as well?
Sure. So I'll just give you an example of a call that I was on with another service that I run with, and we wound up doing an intubation on a patient way down in the Stoughton area, coming up to Madison. And so, I was in the back with a patient doing bag valve mask ventilation with them for a good 20 minutes while we did that transport. And so, going down into the Bellevilles, the areas south of here especially, those transports can be anywhere in excess of 20 to 30 minutes. And well, it doesn't seem that long while you're back there. It's a long time. And if we can provide a consistent level of airway management, tidal volume, rate, oxygen level, all of that stuff that really benefits the outcome of the patient for a 30-minute transport, that's what we want to do. And well, I think we do a really good job doing it manually with a bag valve mask. There is some inconsistencies because we're doing airway and then there's other stuff going on. So we lose sometimes our focus on, because we got a lot of stuff going on at one time, and this just takes that right out of the picture for us. So we're really confident that our providers will we'll use the piece of equipment. They're really energetic about doing the training and getting to learn that. And we've added some airway management, not just the ventilator, not just the equipment side of it, but respiratory side of it to our training as well. We had someone from Madison College come in and do some airway management ventilator training with provided it online for us. So we're really taking it, I think, our care to the next level.
Yeah, and for the layman person who may not understand the importance of airway and all of these tools, I mean, every patient presents just a little bit differently, and you know, the medic being able to have all these tools at their disposal, you know, gives you the opportunity to treat all of these different avenues. And it's never the same treat. You know, it may look like the same or sound like the same, but everybody's a little bit different.
Yep. And I think, you know, we added the ventilators. We've put the Lucas device on there. We've done some really good QA, especially on our cardiac arrest management throughout the county. And I think Patrick and I both feel this is really a next step in how we can care for patients, those long distance intercept calls. And, you know, being over on the west side now, we're picking up calls farther down on Highway 14 and Evansville, that area. So it could even potentially be longer for us.
Yeah, Jeff, thank you so much for breaking all of this down. I dive a little bit deeper in the weeds probably than we should, but I have a little bit of a soft heart there for EMS, and I just very excited for you guys, and we've got some amazing medics here at Fitchburg, and to see you guys bring this on board along with just everything that's really, there's been a lot of tools to be added, but given the pandemic, and to see you guys strive has been awesome. So thank you for sharing, and we hope you have a good holiday season. This will be the last time we talk to you for 2020, so thank you to you and Patrick for all your help this year. We look forward to having you back on next year for more updates.
Thank you for the support. We always appreciate coming on. We always appreciate the support that you give us, and you're always pushing us forward, and we appreciate the opportunity to come on and tell our community and the people that support us throughout, Fitchburg, Verona, and the town. Without them, and they're, we do bill for our service, but we also have tax dollars, and without their support from our communities and the public officials that support us, we obviously wouldn't be able to do what we do. So we want to thank you, and we want to thank them as well. And Merry Christmas and Happy New Year, and we'll look forward to a better 2021, right?
Hey, we're all ready to shut down 2020 for sure. So we'll end it there. Jeff, thank you so much for your time. We'll catch up with you next month.
Okay, take care.
You bet. All right, Jeff Doslick, Fitchburg EMS. We'll check back in with them, like I said, back in January as we kick off 2021. Take a quick break. More to come. You're watching Talking Fitchburg.
Hello, I'm DHS Secretary Designee Andrea Palm. We are making progress in turning the dial on COVID-19, but for Wisconsin to bounce back, we still need your help. If you have symptoms, we need you to get tested. That helps us better track the spread and box in this virus. Over the last 2 months, we've worked tirelessly to make sure everyone in the state who needs a test can get one. If you have a cough, shortness of breath, fever, chills, a new loss of taste or smell, muscle pain or sore throat, and have put off getting tested, don't delay any longer. Testing is easy and will help keep your friends and family safe. Call your doctor for a test or visit dhs.wisconsin.gov/testing. Together, we will get through this and get Wisconsin moving again.
Sponsored by the Wisconsin Department of Health Services.
Welcome back into Talking Fitchburg. Wrapping up the show for today, I want to thank Jeff for sticking around with the 2 segments today. We'll get those posted up online for you later tonight, so you can check those out. And we'll look forward to talking with Jeff again in the near future, 2021. All right, as we wrap up the show, remember, you can stay connected with Fact TV. It's easy, fast, fun, free. It's all of the things I always say. But you got to go there. If you haven't been to any of our outlets, now's the time, right? FitchburgWI.gov. Have a great day.